Great.
Great. Well, good morning, everyone, and Senator, welcome. You know, on behalf of ASBC and the American Sustainable Business Council, we're so thrilled that you could join us. The American Sustainable Business Council and the Senator's leadership on so many issues in this country, awakening the country. You know, his words, his actions, his understanding of the bold actions that we need to take in this country in order to get to a place that we would call the sustainable future, the sustainable economy, where the values of people, communities, employees are met, where the needs of building a regenerative environment, a protected environment are met, right? Where we have a just and a strong economy, but that works for all. These are the kinds of values that we hold at ASBC that, Senator, you have been championing for years. And it is around healthcare. There's so many issues that we connect on, but it's around healthcare. When ASBC and its leadership stepped up to push forward on single-payer healthcare in order to address it, right? We came from that business place, that place of understanding what are the values that we needed to create, what are the principles behind this, right? Of transparency in a healthcare system, competitiveness, lean production, right? Value for what you get. Not look at the drug pricing that we're dealing with in this country. Look at the administrative fees in the healthcare systems. You know, the bloated profits that are taking place. Right, that doesn't mesh with our way of thinking of the way the economy should run and the way business leaders should move forward. Senator, today we've gathered a number of our business leaders that will be heading up to the Hill to be able to bring this message of a new way of business thinking, a new way to build the economy. So it's with great pleasure that we bring you Senator Bernie Sanders.
Let me thank David for that introduction. Let me thank all of you for being here today and to tell you that you and the business community can today play a revolutionary and historic role in transforming this country. Because the main message that I'm going to make to you is that when you go up to the Hill, presumably the business community and the conservatives, they are supposed to be opposed to single payer. And if you ask them why, they're not quite sure, but it means more government and so forth and so on. And yet all over the world, businesses understand that national health care programs are good for business. So the fight that we have right now is to get beyond the knee-jerk ideology and get into, as David mentioned, what's good for business.
Right.
And if you're interested in what is good for business in this instance, Medicare for all, single payer is the way to go. So you guys have a unique role. We are working very hard, my staff and I and grassroots organizations all over this country are working very hard to develop the momentum that we need to go forward. And obviously our first constituency are millions and millions of people who have no health insurance or who are underinsured or who are paying too much for the insurance they have. That is our natural constituency. And we're reaching out to them. And our second constituency, interestingly enough, are many, many thousands of doctors and nurses who know the system inside out and are sick and tired of arguing with insurance companies as to whether or not they can provide the type of therapy and care that their patients need. And in fact, you have a whole lot of younger physicians who are extremely demoralized about being doctors. They got into medicine They got into nursing because they wanted to help people. And they had to study and go to school forever to do that. And then they find they can't find themselves in a position of being able to practice the medicine they were trained to do and that they want to do. And we work very closely with a very large union called National Nurses United. And you should hear what they have to say about the limitations of their capability in providing the health care that they need. So we have some natural constituencies out there, but the constituency that you represent is one that has not been as active in this struggle as it should be. And you guys can play an unbelievably important role. And before I go further, let me thank not only all of you for being here, but I think we have at least 4 people from my small state, which in many ways has been a leader in progressive business efforts. And we have Dan Barlow. Where's Dan here? Dan, thanks for being here. And Pat Hefferman, Pat, and Martin Wolf, 7th generation, and Jeff Hollander. Jeff, thanks a lot. And these guys, by the way, are not only sympathetic to the idea of single payer. In Vermont, we have a business community that in many instances understands that the environment and healthcare and education are in fact good for business, and I thank them very, very much. All of you know, and we got to put this on the table, and we are, the idea of Medicare for all is not a radical idea. We all got that? All right. In fact, the United States of America, our nation, is the only major country on earth not to guarantee health care to all people. All right. We are the only one. Now, I live in Burlington, Vermont. 50 miles north of us is Canada, and they have been doing Medicare for all single payer for many, many decades. And in fact, just this Saturday, I'm going up to Toronto along with a couple of doctors and a nurse to visit hospitals there, to talk to their premier in Ontario. Very proud. She's very proud of the system that they have. And it is very popular. It's not a perfect system. There's no system in the world, as you all know, that's perfect. But again, we are the only major country that does not recognize healthcare as a right, not a privilege. And that gets then literally beyond healthcare. That gets into a very deep philosophical level. Do we think that just because somebody has a whole lot of money, that person or their children are entitled to get the medical care and the health care that somebody else who doesn't? A very deep philosophical question. And that issue has been magnified many times by my Republican colleagues who in the last few months have tried on 5 separate occasions to throw 15, 20, up to 32 million Americans off of the health insurance they currently have. In fact, they're back again with the budget. So on one hand, and this is really deep stuff, and it talks to the right-wing, extreme right-wing movement of the Republican Party. They're saying, I'm sorry you have cancer or diabetes or heart disease and you're on Medicaid and that's what's keeping you alive, but we're going to take that away from you. That is one point of view, which is a very minority-centered point of view in this country. Relatively few people believe that. Our point of view is that healthcare is a right for all people, and we believe we can run a much more cost-effective healthcare system than the current system allows. Today we have, it's important to know, we have 28 million people who have no health insurance despite the gains of the Affordable Care Act. And what is not talked about enough is that millions more have health insurance, and they also have high deductibles and high copayments. And the result of that is that if I have a high deductible or high copayment and I get sick, you know what? I don't go to the doctor. And then you talk to doctors in Vermont or any place else, and they will tell you that they lose patients because those patients walk into their offices far sicker than they should have been. And the doctor said, why didn't you come here 6 months ago when you first noticed your symptom? And the answer is, I didn't have insurance or I couldn't afford my deductible. And sometimes those situations become terminal. Second of all, and this is again from a business point of view, make this point over and over again. Tell the members of Congress that you see that you are sick and tired of the United States of America spending twice as much per capita on healthcare as any other nation. Now, what kind of business person would be satisfied when the quality of the product in many cases is not as good and you're paying twice as much for that product? We are now spending unbelievably, I mean it really is quite unbelievably, $10,000 per person per year on healthcare. $10,000. That is double what the Canadians spend and more than double what they spend in the UK and in France. So if you argue, is the American system better than the French system, better than the Canadian system, I think a lot of people would say those systems are better. But then you got to throw in the fact that we're spending twice as much per person. So what business person spends twice as much to get value that may or may not be as good as other countries? And the system is getting worse in many respects because the costs are going to soar. That is what the analysts tell us. Right now we're spending $3.2 trillion a year on healthcare. It is estimated that in the next decade we're going to be spending $49 trillion. Cost is soaring in terms of healthcare. Now, the other point, and maybe we can open this up for a little bit of discussion, and I remember this issue when I was mayor of the city of Burlington, dealing with cities and towns all over the state as part of the League of Cities and Towns. How much time and energy do you guys end up spending in providing health care for your employees? A lot of time? Yeah. And if you're a small business, you're going to have to hire somebody, and every year, what are you going to have to do? You're going to have to go out for competitive bidding to see which insurance company might provide you with the best deal that you can have. Is that right? And you got to hire people to administer that. And if, God forbid, you're a small business and somebody has cancer, that's going to impact the whole dynamic of your healthcare situation. So it is not only that you as small and medium-sized businesses are spending a lot of money on healthcare, you're also spending a lot of time. I would suspect that most of you are in business to do the business, not to run a healthcare system. And all over this country, the amount of time and energy that has to go into dealing with health insurance is sapping, I think, the capabilities of American businesses to do their business and their competitive capability. If you are dealing with, in competition with a European company, the likelihood is, the reality is that that European company is has healthcare provided to them for their employees. What would it mean to your business? Think about this. If you no longer had to worry about healthcare in terms of your employees, because every person who worked for you had good quality healthcare on a permanent basis. Does that make a difference in your business outlook?
Huge. Huge.
Okay. Some of you I know Richard Master. And Richard is the owner of and the CEO of a $200 million a year company which manufactures picture frames in eastern Pennsylvania. And Richard spent a good deal of time studying the issue of healthcare. And what he found is that 33 cents of every healthcare premium dollar his company is spending has nothing to do with the delivery of healthcare. Instead, 33% of his healthcare budget was being spent on administrative costs. Okay, back David's point. We are an inefficient system which spends hundreds of billions of dollars every single year on administration rather than putting that money into healthcare. A Medicare for all single-payer system would save you and save employers all over this country substantial sums of money, because we are eliminating private health insurance profits and overhead costs and much of the paperwork they impose on hospitals, doctors, and employers like you. Today, about 21 cents of every dollar spent on private health insurance goes to overhead and profit. In contrast, Medicare spends only 2% on administration. The goal of healthcare financing is to get as much money into the doctors, into the nurses, into the hospitals, not into bureaucracies and insurance companies and administration. On the Medicare for All, the bill that we wrote, the American people would be able to go to any doctor or hospital they want. Don't let anybody tell you otherwise. The major difference is that instead of having a Blue Cross Blue Shield card or another private insurance company card, they would have a Medicare for All card. And I think the best selling point that we have, does anybody know what the most popular insurance program in America, that a health insurance program is? Anyone know? It's Medicare. People have more confidence in Medicare than any other health care insurance program in the country. All that we are doing is saying is that right now we have a good program, it needs improvement, for people 65 or older. Let us expand that program to every man, woman, and child. Let us do away with the absurdity of Medicaid for the poor, private insurance over here, the public insurance program for the elderly. Let us have one system which is simple, where the administrative costs will be significantly lower, where people will have freedom of choice. The only difference is people will now have a Medicare card rather than a private insurance card. They will go to the same doctors who will function in the same way. They will go to the same hospitals, and they will function in the same way as well. Now, here is the good news politically. The good news politically is that we are gaining momentum. Why? Because the people of this country felt very strongly that what the Republicans were trying to do was really ugly, and they stood up and fought back against that. But they also understand that the Affordable Care Act has not gone far enough. Too many people are uninsured, too many people are underinsured, the cost of prescription drugs are off of the charts. So the American people, I believe, and the polls indicate this, are prepared to go forward, and we need your help to make us go forward. Last point that I want to make, which is on your mind. What about cost? How are you going to do? Well, we think you're going to do better under a Medicare for All. Now, here's where the lies come in, the really bad stuff that you're going to be seeing here on Capitol Hill. The 30-second ads are going to say, you are going to be paying more in taxes under a Medicare for All program. Taxes are going to go way up. It's true. You're going to be paying more for taxes. You know what you're not going to be paying? Any private insurance premiums. And somehow my Republican friends think that the American people just love paying out private insurance premiums that are going up every single year. But if they paid less in taxes than they're paying in private insurance, that would be a terrible thing. The way we figure it is that the vast majority of the people in this country, the average middle-class family, would be saving a good chunk of money, paying more in taxes, not paying any private insurance, no deductibles, no co-payments. And the average employer, i.e. you, would also be paying less. So when somebody says you're going to be paying more in taxes, respond, yeah, I'd rather pay more in taxes and less in private insurance. I will be better off. I'll be better off when I take the burden of having to figure out health care for my employees off my shoulders. I'll be better off when I don't have to spend half my life worrying about how I get private insurance to my employees. So that's where we are today. The momentum is with us. I introduced a Medicare for All bill. A couple of years ago, we had one sponsor. He was really good. I liked him very much. But this time, we got 16. All right, we have 16 co-sponsors, and many names of folks that you would know, some of the leaders in the Democratic Party. So we are, and poll after poll show more and more support. The majority of the American people now want to move in this direction. All right, let me just take any questions that people may have now.
Hi, I have an underwriting background in benefits, and so thank you. I couldn't agree more. My question is, why is there no discussion around the prevention side?
Good. All right. But now you're getting into deeper issues. Again, what is the function? I mean, let's not be naive here.
Yeah,
what is the function of healthcare, the healthcare system today? Any sane person would say the function of healthcare is A, to provide healthcare to all people, to do it in a cost-effective way, and C, to do everything we can to keep people healthy. So if we invested, for example, in programs that stop pollution. You know how many kids in this country have asthma? You know what kind of epidemic we have today with diabetes? You know what obesity is back? You know what the opioid epidemic is like? If we invested in prevention, God only knows what we can save. Give you another example. Don't get me going on this. Just give you one more example. It's how crazy the situation is. Every other country on earth, major country, does a much better job in primary care than we do. Now, we got a lot of problems, but one of the major problems we have is in terms of primary care. Do you know there are millions of Americans today who have insurance who can't find the doctor when they need to? You got rural areas, you got urban areas, people. Now, if you get sick and you can't get to a doctor, what happens to you? You're going to get sicker, and you may end up in the hospital, and that is a huge cost to the system. You know how you save money? You save money by saying when you're sick, you go to the doctor. And you have medicine that is affordable to you. We have 1 out of 5 people in this country who cannot afford the prescriptions that their doctors write. Now, forget about the morality of that. Tell me about the economics of that. Is that sane in any sense?
It is. Can I just add one other thing? And again, I come from like Wellness Council of America, National Business Group on Health. And one of the things that we know is 75% of the illnesses that we're paying for are lifestyle related. And I think with this burning platform of type 2 diabetes that keeps increasing and Alzheimer's, that it's a huge concern from our perspective that if we don't start talking about the preventive side of this, not just when I get sick I go to the doctor, but how do we prevent cancer? How do we hold off?
It gets into nutrition and all that. But then that takes you to another area, which, as you know, many of these issues, low-income people are going to smoke a lot more. Low-income people, you go to West Virginia, you go to Kentucky, there is a terrible, I mean, my state as well, but not as much, an opioid epidemic. Why are people turning to opioids and heroin? I mean, but I even go to the issue that we have the highest rate of childhood poverty. If you are a low-income single mom and you can't find decent, affordable child care for your kids, and your kids don't get off to a decent start in life, what's the likelihood of that in terms of health care costs? All of these things are related, you're exactly right. But the point is, at the end of the day, we save money by doing the right thing.
And we've connected also the whole safer chemicals sets of issues, the impact on the environment. If that doesn't have a direct impact upon the health and well-being of moving to what we know business can do, is create safer, healthier products out there. And that's the kind of policy that we're also driving on. We have a mic going around as well. Got it? Good.
Thank you. Senator, can you give us a fairly solid figure on what your estimate of Medicare for All really is? We've heard a lot of numbers all over the...
I'm sorry, what the estimate of?
Yes, the actual cost that you think that Medicare for All will be. We've heard a lot of numbers and they all seem to be all over the map.
And you will continue to hear that. Look, anybody, for all the reasons that she raised, among other things, all that I can tell you is that we are now spending twice as much as our friends in Canada, more than that in terms of our friends in Europe. And their healthcare outcomes in many respects are as good or better than ours. Now, it's going to be a lot of lying and dishonesty on this thing. But that's the first premise that we start with. The reason I can't give you a definitive answer is first of all, nobody can. I mean, it's such a huge issue. There are estimates, credible estimates, though. I think it's the, who made the 49 trillion?
The 49 trillion?
Yeah.
Well, you know, there was a CBO. And
CBO, all right. Yeah. Congressional Budget Office. That we're now spending what would be 32 trillion. It's going to go up to 49 trillion if we do nothing. But the reason I can't give you an answer is just exactly, among other things, the point that this woman made, is if we do the right things and we do more in prevention, can you tell me, can anybody tell me what the impact would be if in the United States we paid the same prices for prescription drugs as they do in France? It'd be a huge decline in costs. So all I can tell you is that all of the studies that I believe tell me that per capita we can do a heck of a lot better than we're currently doing.
Thanks.
Yeah.
Yeah, I'm with the...
Just hold on. Yeah, wait for the mic. Okay, just coming right there.
Hi, I'm with the Healthy Business Alliance for Healthy California. We work very closely with the nurses and the other activists. I was wondering if you have any comments on what is the role of advancing the single-payer model in different states versus at the federal level, which is where it should be. But
yes, it's not either or. We got to go forward in both cases. If you in California can make progress in passing a Medicare for all, it'll be a huge step forward. Huge step forward. I think some of you may know the history of the Canadian effort. It started in Saskatchewan. It started in one province where you had a very, very courageous premier who took on a doctor strike, took on the whole media, took on everybody. They won, it worked well, and then the other province had said, hey, I got a cousin in Saskatchewan, why can't we do it? Other provinces, and then eventually became national.
And so key to point out that we have the leadership from California, there's a business group in Oregon, there's New York state leaders that are here, and of course, there's the folks in Vermont that we know we're going to be moving this bill again in Vermont as well. So there's that grassroots business organizing that is taking place across the country. Where's the microphone? The light? Yep.
Hi, I'm Charlie Wood. I'm from England, and I just want to say once that personally, I find it amazing how it was Keynes's Keynes's deal with the United States after World War II, which helped pay for our NHS. But I'd like to ask, what of the other 5 giants that Beveridge points out in the Beveridge report of 1942 do you think that we need to go after in terms of squalor and ignorance, and by that he means housing and housing and education? Do you think that they are all mutual in
well, that is our goal. We didn't need Keynes to tell us that in 1944, in a speech that is not remembered very much, Franklin Delano Roosevelt did before he died. He gave a speech, it was a State of the Union speech. And he said, you know, we talk about American freedom when we talk about the Bill of Rights, and we talk about our Constitution, and that's very, very important. But we have also got to talk about economic rights. The idea that healthcare is a right, a decent paying job is a right, that a farmer has a right to earn a decent income, that people have the right to live in affordable housing. Those are certainly the goals of a civilized democratic society. And that takes you to the whole issue of income and wealth inequality. It takes you to the whole issue of Citizens United and the corruption of our political system. And the fact that we are moving right now on the right-wing Republican leadership in precisely the wrong direction. But you know, bottom line is that what the UK did after World War II under a Labour Party was to establish your national health system, which is something that the people of the UK are very, very proud of. It has its problems, but people are very, very proud of it. And I will remember a number of years ago when we were debating the Affordable Care Act. Turns out I went to the UK with a delegation of American senators, and you had members of Parliament who we met with, conservatives who were absolutely appalled by the kinds of lies that were being told in the United States about the NHS.
We have time for one more. Got it? Okay.
Senator, you mentioned the prescription drug price gouging that we have, and I'm from the Philadelphia area. We have a fair amount of biopharma companies that are enjoying that deal. What's your sense of? I'm thrilled that there's momentum happening on single payer. Are we having any momentum about allowing Medicare to negotiate the price?
Well, we're working with a number of senators, and we're going to reintroduce legislation to do just that. I mean, this is how corrupt the system is. In the UK and all over the world, the cost of prescription drugs, the same exact, I'm not talking about a generic, the same exact drug is sold at significantly low prices. Why is that? Anyone know why?
Good market.
No. Because they negotiate. Because the national health system or the Canadian health system says, fine, you want us to buy your product, we buy a lot of it, we'll sit down and we'll negotiate a good price. Every other major country does that. In this country, the drug companies can charge you any price that the market will bear. And that is precisely what they are doing. You have all seen the outrageous examples of drugs where prices have been raised 10 times because they think they can get away with it. So number one, we have a two-pronged approach, or at least a two-pronged approach. Number one, Medicare, which pays for zillions of dollars of prescription drugs, should negotiate prices. We're going to be introducing that legislation. Second of all, for all of these guys who are free traders, and they love the fact that we can get products from all over the world, somehow or another we can't get safe, FDA-inspected prescription drugs from Canada. Can't do that. And that's just the power of the pharmaceutical industry that has spent billions of dollars in the last 25 years on lobbying and campaign contributions. Bottom line is, let me conclude by saying this is not really a healthcare debate. Very hard for the other side to defend the status quo, or worse. This is a political debate. It is an economic debate. The function of the current healthcare system is not to provide quality care to all. It is to make as much money as possible for the drug companies, the insurance companies, and other people in the industry. And they are succeeding while the American people are losing. So let me conclude the way I began. You guys have a very, very, very important role to play in this debate, because people don't expect business people standing up and fighting for a Medicare for all. Please go out and talk to other business people. Don't talk about it morally, don't talk about it philosophically, talk about it bottom line. That if they want to save money and make sure that their employees have good quality health care, this is the way to go. So thank you very much for your leadership on this. Thank you all.
Many other thousands. There's over 13 other business organizations that have joined us, representing over 10,000 businesses on this issue. But since our beginning in 2008, these and many other thousands of business leaders have been going to legislators at the local, state, and national level to say there's a new way to do business, a new way to build the economy, and it's based on the values of that we can protect the environment, protect our employees, protect our communities, and also build a just and fair economic system. So we stand with you as we move forward to transform healthcare. Thank you.
Lots of hearts. Should I start?